Welcome to Thursday's edition of COVID-19. I'm Min Sanhi. Sporadic cluster infections have raised the daily tally and the concern of authorities here amid level 1 social distancing. Meanwhile, herd immunity continues to be an option discussed by experts here and abroad, as our Kim Ji-yeon is poised to tell us later. But first, here are the numbers on the pandemic with our Kwon Soa. Soa, as we expected yesterday, the number of infections today here in Korea has moved up, I hear.
Yes, Sunny, due to a large-scale cluster infection in the southeastern city of Busan, for the first time in around 3 months, the number of infections outside the metropolitan region was higher than infections in the greater Seoul area. So if we go straight to our map, we do see here the highest number in Busan with 55 cases, and the majority of that is linked to a nursing hospital. Elsewhere, we see 25 cases in the capital Seoul and 11 in nearby Incheon and 8 in Gyeonggi-do province, and also 1 case each in other parts of the country, which means we are actually seeing a decrease when it comes to other parts of the nation.
I see. So are we hearing of additional infections at this nursing center?
Well, Sunny, as of 10 a.m., the number of cases linked to the Headquaters nursing hospital in Busan remains at 53. And if you remember, that was the same number we had yesterday, but this figure has been added to today's tally. Now, health authorities in Busan say so far no additional case has been confirmed following tests conducted on some 670 people, but a little more than half of the test results still have to come out. Now, meanwhile, the number of imported cases has actually dropped to around half of that we saw in the past 2 days. But again, the number of domestic cases is now near 100. This is why today's total caseload stands at 110, and that raises the total to almost 25,000 cases. And the death toll stands at 439 with 1 additional death. But we also have reports of another fatality linked to the nursing hospital in Busan. We may hear of that in our later briefing. Now, meanwhile, going over to our graph now, if we take a look here, we have triple digits twice this week. In the meantime, most of the days we had double digits. Let's hope that the figures won't go further up. Meanwhile, as I mentioned before, the number of imported cases is on the decrease, but global figures are on the rise. Let's take a closer look here. Almost 400,000 here. Over 382,000 cases were reported in just 24 hours. This is a concern because we haven't been seeing many days with over 300,000 new cases. And the death toll here at almost 1.1 million with 6,000 cases added. Now, the countries most affected are the US, India, and Brazil, but we are seeing resurgences in Europe, in fact, which accounts for roughly a third of the global cases. And this has prompted leaders in Europe to take new stringent measures. Now, Russia reported a total of 14,000 cases in just a day. That is a record there, with its President Vladimir Putin saying the country has approved its second vaccine for COVID-19, but again, without going through the phase 3 trials, saying the production of the first vaccine, which was approved back in August, needs to be ramped up along with this new vaccine. And meanwhile, here in France, we also have 22,000 new cases. This is one of the countries that is really worst hit by a second wave of the pandemic, and its President Emmanuel Macron imposed a curfew from 9 p.m. to 6 a.m. in Paris and 8 other metropolitan regions, which will begin on Saturday. And meanwhile, Germany also reported a daily record high of over 6,600 infections, and this country is back on the list of 20 highest infections here on our list. And Chancellor Angela Merkel announced tougher curfews as well as restrictions regarding private gatherings and rules on wearing face masks. And those are the updates I have for now, but I'll be back with more after the afternoon briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you later. Now, the resurgence of COVID-19 in quite a few countries across the globe is also reigniting debate over herd immunity. The global health body, that is, for its part, has denounced the option calling it immoral. I have more on this with our Kim Ji-yeon here in the studio. Welcome, Ji-yeon.
Hello.
Ji-yeon, let's begin with a simple definition of the term herd immunity.
Sure. Herd immunity describes a state in which a large share of a population is resistant to a disease, thereby preventing a widespread infection, providing protection to a minority of people who either don't have natural antibodies or have not been vaccinated. But since we're still working on the COVID-19 vaccine, achieving herd immunity right now would require a large number of people to contract the virus, survive it, and then produce sufficient antibodies for a long-term protection. The World Health Organization has strongly discouraged countries from any attempts at achieving herd immunity at the current stage.
Herd immunity is achieved by protecting people from a virus, not by exposing them to it. Never in the history of public health has herd immunity been used as a strategy for responding to an outbreak, let alone a pandemic. It's scientifically and ethically problematic.
The WHO chief cautioned that herd immunity is a concept used for vaccination to determine the threshold needed to protect a population from certain virus. For example, herd immunity against measles requires about 95% of a population to be vaccinated. For polio, it's about 80%.
Right. Questions are also being asked, Ji-yeon, about our body's ability to make enough antibodies to keep us from falling sick with COVID-19 a second time.
Yes, fresh concerns are mounting amid reports that a COVID-19 patient died after contracting the virus the second time, the world's first recorded death of a reinfected patient. It could further raise questions on our body's ability to form immunity against the virus and the duration of antibodies after recovering from COVID-19. According to a research reported by the Clinical Infectious Diseases Journal, an 89-year-old Dutch woman who was being treated with bone marrow cancer died after contracting the virus for the second time. Her case may also provide a cautionary tale for those mulling over herd immunity approach, which is based on the assumption of lasting immunity for those who've been infected with COVID-19 and then survived it.
Ji-yeon, I also hear that she suffered much more severe symptoms during her second battle with COVID-19. Is that right?
That's right. Earlier this year, she was confirmed with the virus for the first time. She was discharged from the hospital just 5 days after her symptoms improved. Some 50 days since being discharged, the patient was reinfected with the virus, but only this time she was running a high fever, coughing, and had breathing problems at a time when she was undergoing cancer treatment. And her condition worsened and she died 2 weeks after her second diagnosis with COVID-19. Although COVID-19 has been cited as the woman's official cause of death, the research stated that in the patient's case, her immune system could have been severely weakened due to cancer therapy and her old age was taken into account. But despite these underlying factors, COVID-19 was cited as the principal cause that led to her ultimate demise.
Meanwhile, antibody studies are being carried out by many countries across the globe, including Korea, of course, to gauge the level of antibody immunity, to gauge the overall immunity that would be in their respective populations. Do we have insight on these endeavors so far?
Well, I've talked to experts and they say it's too early to derive any meaningful findings from these antibody tests at this stage because there are so many variables, and as you can recall, early results have shown that in the case of Korea, the immunity rate was very low at less than 1%. 2 rounds of nationwide antibody tests with the results being published in July and September this year by Korean health authorities show the country's immunity rate stood at less than 1%. And we do have to keep in mind that the sample size was very small, with the second round of antibody tests being carried out on roughly 1,400 people, a tiny fraction of Korea's total population. Looking at similar studies conducted abroad, the cities with the highest immunity rate include New York City at nearly 25% and London at 17%. But even these are well short of the threshold necessary to reach herd immunity.
I see. All right, Ji-yeon, thank you very much for that report. I'll see you again soon.
Me too.
Right, it's a little after 2 in the afternoon and we are poised to join the regular afternoon briefing on COVID-19 here in Korea. Authorities are urging for greater public responsibility in containing the contagion as they point out that simple and practical personal hygiene habits go a long way in keeping the virus at bay. Now, as we wait for the briefing to commence, let's take a look at the East guidelines under Level 1, which went into effect this past Monday. Gatherings of more than 50 indoors and 100 outdoors are allowed, but here in the metropolitan area, they are still being discouraged. But should such gatherings be held, authorities are calling for stringent safety practices and the proper spacing of people. In the academic arena, cram schools of more than 300 people have resumed classes, while come October 19th, that would be next Monday, schools can accommodate 2/3 of their student body. With regard to high-risk establishments and operations, clubs, bars, singing rooms, as well as buffet restaurants are among the 11 that can resume business, while door-to-door sales activities remain banned. 16 other public use facilities, such as cafes and ordinary restaurants in the capital region, face tough safety measures while open. The briefing is about to start. We'll come back to you afterwards.
설명이 있겠습니다.
Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of October 15th, Thursday, we have a total of 95 new local infections and 15 new imported cases. And as of now, the total caseload stands at 24,988. Currently, we have 1,467 people in quarantine, and among them, we have 82 people in critical conditions. And yesterday, we had one additional fatality, and the accumulated death toll now stands at 439. I extend my deepest condolences to the deceased and the members of the bereaved family. Let us now take a look at the major updates on our domestic infections. In Seoul City, and regards to a funeral in Seodaemungu District, we also carried out additional contacts, and we have a total of 15 cases being confirmed to date. And in Seoul's Dobonggu District, in relation to the Dana Hospital, we also have confirmed that one additional case has been confirmed. In total, the accumulated case stands at 65. And in Gyeonggi-do Province, in Dongducheon City, in relation to a social gathering there, we also found 2 additional cases, and a total of 25 people have been confirmed to date. And in Incheon City, Namdong-gu District, in relation to a restaurant there, we also have additional cases being confirmed after the index case, and a total of 12 cases have been confirmed, and a total of 13 have been confirmed to date. We are under investigation as for the infection sources and the index case. And in Gangwon-do Province, in relation to Gangneung City social gathering, we also have found that this was in relation to an unidentified cluster case stemming from Songpa-gu District in Seoul, and we have also reclassified the cases, and a total of 16 cases have been confirmed to date. In relation to Busan's Headquaters Nursing Hospital, we also have additional cases being confirmed. A total of 22 additional cases have been confirmed. In total, we have 53 cases to date. And as for other cluster infections, please make your inquiry to the spokesperson's department here at the ministry. And today is also, we would like to spend some time today to explain to you about the outbreak trend after the Chuseok holiday. And we have also spent some time, a decent amount of time after the Chuseok holidays, and we have seen about 8 cluster infections, about 130 people in relation to cluster infections related to families. And we also have 2 cases, 2 cluster infections, about 140 stemming from hospitals, and about also a total of 16 cluster infections amounting to about 328 patients in total. And while it is, and we are currently at a controllable state, however, we have seen a slight increase in the number of cases stemming from family clusters infection as well. And as for these 8 cluster infections stemming from family gatherings and social gatherings, we have seen that the infections have been spreading through group meals and gatherings as well. And among the young people, we also have seen that the infections are also carrying out being at the multi-use facilities as well. And we have seen the ease of suspension of business operations. However, we need to also highlight the importance of quarantine measures at each of these multi-use facilities. The quarantine authorities will currently continue to monitor the outbreak trends in the metropolitan areas and the non-metropolitan areas as well. And yesterday as well, out of the 95 cases, we have seen 52 cases, which is about 55% of the total, coming from the Headquaters Nursing Hospital. And this is why we need to take utmost care for the nursing hospitals and the mental hospitals as well. And we also have a higher infection of rates there. Higher rate of infection there because most of these people have chronic illnesses as well, and therefore we would like to continue to look at the nine nursing hospitals in Busan area, and we have tested all of the 1,300 people who are currently admitted to these hospitals there. And however, we did not see further cases of people testing positive. However, we would like to continue to take out most priority in considering and monitoring the situations in Busan City as well. And we will also collaborate closely with the local governments, and we will continue to carry out extensive mass testings for those areas that have mass outbreaks as well. However, we need to also contain the virus from stemming to the community, and however, there are some limitations and restrictions. Of course, testing is very significant. However, it is also helpful only when we distinguish and identify the cases. So, for instance, if one has tested positive, we still have the possibility for this person to test positive the next day, even though the person has tested negative the day before. So it is very important for us to cut these transmissions. Today, Today, the 15th of October, that is the hand washing day designated by the UN. And it is a very meaningful day, especially because the world is continuing its battle against the COVID-19. And commemorating this a very special day, world leaders and also world health leaders as well are urging the public to wash their hands as well. We will tell you once again, but wearing a face mask and washing of your hands are essential preventive measures against the virus. So when you wash your hands, please use your soap and also wash thoroughly with running water, and this can also help you prevent infections as well. If you cannot wash your hands with running water, please disinfect your hands with sanitizers. This will be very helpful, and it is very important to note that the COVID-19 is also not very resistant against the soap as well as the hand sanitizers. According to some of the data conducted by the U.S. health officials, we have seen that washing of your hands can also decrease the risks of infection of respiratory diseases by a whopping 20%. So this 20% itself is a very important number. And also washing of your hands and wearing of your face mask and also social distancing measures is very important in curbing the virus and containing the virus. And through such measures, these will be very helpful going forward. And today, as we mark the hand washing day, we ask you to wash your hands again. Thank you very much.
Right, that was Lee Sang-won from the Central Disease Control Headquarters with Thursday's afternoon briefing. So, what was the gist of his briefing today?
First off, he had an assessment of the coronavirus situation here in Korea after the 5-day Chuseok holiday, which ended 11 days ago. And he mentioned that there have been 328 cases after that period, and 130 of those were related to family gatherings or gatherings among friends. There were also over 30 cases related to multi-use facilities and over 110 cases related to medical facilities, as well as over 80 cases that are related to the military. So what we can see here is that many cases that have occurred among family members is a concern, but it looks like we do not have a massive outbreak after the Chuseok holiday, which stemmed from the Chuseok holiday. But we do have that case that's a big concern right now in Busan, as the nursing hospital, the Headquaters nursing hospital, has a total of 53 cases. But there seems to be no additional case from yesterday when most of the cases were confirmed. In the meantime, we do also have sporadic cluster infections in the capital Seoul and Gyeonggi-do province that are related to other hospitals, as well as a funeral facility here in the capital Seoul. So we will still have to, be vigilant regarding those facilities.
All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, it's been 7 months since the global health body declared the COVID-19 outbreak a pandemic, one that has infected well over 38 million people across the world and killed more than 1 million. So what else has been learned about the new coronavirus thus far? Well, we've brought together some of the latest findings in this next report to take a look.
A recent study on COVID-19 by a team of Hungarian researchers has come under the global spotlight. The team carried out several experiments on COVID-19 viral particles, probing them with a needle and exposing them to high temperatures. The study concluded that COVID-19 is highly resilient, heat-resistant, and had the ability to self-heal.
This is a very resilient virus, which means that as we press the surface of the virus, basically we can push it all the way so that it is pressed wall to wall. We have done it up to 100 times, and basically from our results, it is evident that it always returns to this nice football shape.
Even when the viral particle was heated at a temperature of 90 degrees Celsius for 10 minutes, the particle's structure remained mostly intact, maintaining its spherical shape.
After the virus has been exposed to such a thermal treatment, it's typically take care of it and the infectivity is gone. So it cannot infect, but the genetic material and the protein shell is still there.
So just how long can COVID-19 particles survive at room temperatures? Another study from Australia also showed that COVID-19 could survive as long as 28 days on glass surfaces and paper currency notes at 20 degrees Celsius.
What we found with the smooth surfaces is the survival time on those surfaces was longer, 28 days for those surfaces, that we were still able to detect small amounts of infectious virus. And that was at 20 degrees. But when we increased the temperature, so at 30 and 40 degrees, those survival times were a lot less. The results are not to scare people, but to help inform around the characteristics of this virus, which we're still learning about how it spreads.
In addition to its resilient nature, COVID-19 also displayed a tremendous ability to bind to human cells. Researchers in Germany discovered that COVID-19 spike proteins are extremely flexible, allowing them to bend freely and maximizing their ability to latch on to human cells.
And this would be difficult, or more difficult, if the protein were rigid, because then you would have to have it perfectly orientated. So this flexibility allows it to, just like a piece of sticky tape, to attach much more strongly. Seeing with such a high resolution, and also now with dynamically, how these surface proteins move around and how they can achieve their function is very helpful, I think, for the field overall and for the fight against the virus.
A striking photo was published recently on human cells that have been infected by COVID-19. It's a microscopic image of COVID-19 infecting a person's respiratory tract. The blue hair-like cells are called cilia, which help move microbes and debris out of our airways, and the red particles are COVID-19 virus molecules. The team was able to determine how fast COVID-19 could replicate itself after invading a person's respiratory tract.
Within 2 days post-exposure to the virus, these cells are becoming essentially a virus factory. They go from producing 1,000 viruses per culture to 10 million viruses per culture in only 2 days. So, finally, when we were seeing how jam-packed with viruses these infected cells can become, so it's very important to wear masks for all of us when we cannot physically distance.
These new research findings, though disturbing, could help us find new remedies and eventually bring an end to the global pandemic.
세계는 지금 감염병과 자연재해 앞에서 그 어느 때보다 기후 환경에 대해 깊게 성찰하고 있습니다. 지구를 되살리기 위해 작은 것부터 실천하고 국제 협력을 넓히고 있습니다.
In the early stages of the pandemic and amid the lockdowns imposed by authorities, there was talk about a reduction in carbon emissions and the improvement of air quality in quite a number of places. However, now, months later, there is growing concern over the surge in pandemic-related non-recyclable waste products, including face masks and, of course, single-use disposable packaging. But the relationship between COVID-19 and the environment appears to go well beyond that of just pollution. So for a better understanding of the complex nature of this relationship, I have Professor Sonoo Young from Konkuk University. Welcome to the program, Professor Sonoo.
Thank you.
And I also have Andreas Royman from the Green Climate Fund. Hello, Mr. Royman.
Hello, thank you.
Mr. Royman, I'll start with you. Can we begin with an explanation, a simple one perhaps, if possible, about man's abuse of his environment leading to the outbreaks of infectious diseases like COVID-19?
Indeed, a very good question to ask. My colleagues and I, from the Independent Evaluation Unit of the Green Climate Funds, we look at that question of evidence and causality. And what we found is that, yes, the World Health Organization has yet to deliver a clear link and clear relationship between COVID and climate change. What we know, though, is from past experiences, so from past pandemics such as Ebola, MERS, and SARS, we know that over 70% of human diseases are related to animals. And that gives us a very good question to look at global warming. So when we look at global warming, let's look at the planet and think about the planet as a minefield of pathogens, and those pathogens with a capacity to infect hosts. So climate change is the major or the single most important catalyst for this opportunity to arise. Why? It's simply put, climate change disrupts the ecosystems and therefore forces these pathogens as well as these hosts to move around. So if you think of global warming has affected the species and the wildlife and has caused major changes, and they had to change and leave. That means in result of that, you have species that are now meeting and should never have met before. And that causes that spread that we call a geographic pandemic spread over the last century. So we may want to ask this question, what now? What can we do? What can we do to prevent such future outbreaks? And from the climate perspective, it is to address the imbalance that we currently have in our nature environment. So we need to address the threats to the ecosystem, the threats to biodiversity, the threats to wildlife, pollution, as well as the greater scheme of climate change. And now the question that I'm often asked is, where are we at the moment? And here I'd like to say, from the World Meteorological Organization, for the WMO, it says that we're very far away from actually reaching the Paris Agreement targets that we had put to ourselves on climate change. And here we need to say that we are even facing, in the next century, an increase of 3% in temperature, which would cause dramatic changes that I just described.
Mm-hmm. And before we delve into those rather gloomy changes, Professor Sonu, as I mentioned at the start of the talk, there is reports of improvements in air quality amid the pandemic, in its initial stages, of course. Right. Is there any truth to this?
Well, as we all know, not only air pollution, but environmental pollution in general is a function of human activity. So the more human activity we have, the more pollution we're going to get. The less we have, the less pollution we're going to get. But there are two things that we have to remember. When COVID finally ends, we're going to have a resurgence of human activity. That's going to mean an increase again in air pollution and other types of pollution. The second thing is we have to look at the environmental pollution problem in a comprehensive sense. I don't know if you remember, but in Korea there was this environmental policy for solid waste management called, in Korean, 쓰레기 종량제. In English it would be something like volume-based solid waste management system. From my perspective, it was a failure initially because you had all sorts of illegal burning, in agriculture burning, crop residue and whatnot, and even in the apartment complexes you had a lot of illegal burning going on. That led to a lot of increased air pollution. So in environmental pollution kind of policies, we have to look at it very comprehensively because it's all interconnected. So once COVID ends, we still have to look at it from the COVID perspective, air pollution perspective, in a very comprehensive sense.
Right. And talking about being interconnected, Professor Sonu, there has been research about the relationship between COVID-19 or the severity of COVID-19 and air pollution. Could you tell us a bit about this?
Yeah, I'm not really an expert on this, but there are a lot of studies, obviously, that are going on because it's such a hot topic. To make correlations regarding air pollution and COVID-19 cases, I think is very dangerous right now. Because most health studies, you need some long-term studies. And this has been less than a year. And to make conclusions regarding this is very dangerous. Also, there's a lot of, when you study correlation studies, it means that one reason can have an impact on both results. So a lot of times you have these poor countries that are very bad in treating air pollution. Obviously, you're going to have more COVID cases because their health system is not that great either. So is the reason COVID-19 that is adding to the air pollution or air pollution adding to the COVID? It's very difficult to tell the really one-to-one correlation.
Right, we'll have to wait and see then.
Yeah.
Mr. Royman, now this is something else I mentioned at the start of the talk. There is much concern about the rise in pandemic-related waste products like face masks and, of course, plastic. Just for the sake of clarity, how severe is this issue right now?
Yeah, that's a very good question. It's actually quite severe. So if we think about the single-use face masks as well as other disposals, so we're thinking about plastic waste and others, we can clearly see that this is leading to environmental degradation. So and that's a great concern. So the question of how we could answer to this, well, it is a question of behavioral change. It is really a question of how each and every one of us takes an active step to make this a little bit of a better world. And from a perspective of a Green Climate Fund, we have the mandate to do work in the climate space, but we also want to contribute to this. So for instance, the GCF, the Green Climate Fund colleagues, have encouraged each other to use reusable containers for lunches, use water dispensers, bring their own reusable water bottles to reduce any other plastic waste. And then in addition to this, from an institutional perspective, you could also say that institutions can reduce the use of plastic during conferences or board meetings even. So, and then the other question is coming to the climate mandate. The Green Climate Fund is the largest dedicated climate fund in the world. So we currently have about 143 projects worldwide, which accounts to 6.2 billion, beg my pardon, 6.2 billion US dollars. And these projects are pursuing nature-based solutions. And secondly, are also looking at efficient ways of using our resources. So these are key measures to look into this question of how can we address waste, how can we address a certain peak in waste related to COVID-19. Right. What we say though is, and that's also through our system and through our business model, we work with entities such as the United Nations Environment Programme as well as the World Health Organization, and we encourage countries we work in to look at how these entities can help to mitigate these risks and adverse impacts that we are facing due to COVID. And let me say this again, the GCF in its mandate is then looking at this question of how can we provide support to countries, now in COVID, but also after COVID, to look at sustainable ways, sustainable consumption, sustainable production, as well as decent and green jobs, and the efficient use of our natural resources.
Right. Professor Sono, the use of such plastic products, however, appears inevitable given the current pandemic and given the desire for non-contact delivery services, because we can't go out, well, not we can still go out, but there are people across the world that are facing lockdowns as well. Is there a way to balance our need to stay safe with that of the environment amid the pandemic?
Well, that looks like it's the $6 million question, right?
It is, yes.
Like Andreas mentioned, I think it's very important to re-educate the public regarding the environmental mentality. I always feel that, and I don't mean to put ourselves down, but I have a feeling that we're still a little behind in the environmental mentality aspect compared to like European countries and other countries. But this COVID-19 has put us at a spot where we have to think about all these environmental problems and whatnot. I think it's, on the other side, I think it's a good opportunity for us to try to convince people how important this is. This past summer we had a whole bunch of typhoons and other climate problems, so-called meteorological problems that are maybe or may not be related to climate change. But I think the proof is there now. A lot more evidence is coming in. So being a professor, I think it's very important to educate the public, and not only the public in Korea, but on the whole world.
Right. Mr. Royman, what would you propose as part of efforts to ensure balance then between the need to stay safe and to safeguard the environment in the midst of a raging pandemic?
Well, that's a tricky question to answer, to be honest. But look, as I said, I think what's clearly put out in front of us is now the link that we have. So we have that link between the environment and the health. And I'd like to quote the United Nations Environment Programme. I always use this quote because I find it very, very, very timely. And they say, COVID-19, for the worst things that happened with it, it is also a reminder that human health is very much interlinked with the Earth's health. So we ought to look at this, and we ought to think about ways forward to really create sustainable life here on Earth. And that's a grander stand, to be honest. But let me come back to this question of education and educating people. And I very much endorse this position that we really need to look at how can we change the behavior. And I'm not only talking about the policy side of things. So often, changing behavior is often referred to as we need better public policy that would look at that. But it's actually also for each and every one of us for the day-to-day operations. And I think that hinted, Professor, you almost hinted at that point to say some countries may have approaches that we can learn from. And here I want to say, COVID, for all that it was and that it is currently, it's also an opportunity to learn. And the environment shows us that the environment has a critical role in this, because it not only describes where COVID has emerged from and where the origin lies with COVID, but it also helps us to think about what are ways forward to resolve these issues in a post-pandemic world. And the GCF here puts clear measures in and says, okay, let's look at this question of economic stimulus. And GCF, as the Green Climate Fund, and the largest Green Climate Fund, just to say that again, is clearly advocating for greening of the economic stimulus. And so how would we look at that? We would look at it as low emission and climate resilient stimulus packages that would help the leaders of this world to address both of the questions at the same time. So the economic recovery, as well as the challenges that we're currently facing with climate change. The question then is, these leaders have to look at this question of how to finance this. And coming from the Green Climate Fund, we talk a lot about finance, and we very much advocate for looking at innovation in finance. So innovative financial structures that would help to put these economic stimulus into action, but at the same time do not create additional burdens to vulnerable countries or developing countries as they are already facing a debt crisis in many countries, in many regions over the world. So here we say that there should be a stronger link, and the GCF plays a vital role in looking at how private sector could be linking to climate interventions and climate investments by saying, okay, we look at different variety of instruments that we could employ to help the private sector to catalyze that.
Now, prior to what Mr. Royman had said, I would have thought that the best way to deal with climate change would be to ease our carbon footprints. But based on what Mr. Royman has just said, Professor Sonu, I would think then you would need to perhaps consider the health sector in efforts to better deal with climate change. What are your thoughts on this?
Well, definitely health and safety is very important. But being an air pollution engineer myself, the root cause of this problem, climate change and all these other impacts, is greenhouse gas emissions. And I'm all for directing our energy, our funds and other things on adaptation, on looking at impacts. It's very important. But it must not take us away from going away from the root cause, to preventing the greenhouse gas emissions, which is the sole cause of all these problems. Korea especially, I think, is in a position where it's not very looked highly upon regarding climate change issues. Just recently, we were quoted by an NGO, climate NGO, as being one of 4 evil countries regarding climate change, which is not a stigma that you want to have attached to your country. Also, we're still struggling with coal-based power plants, not only for our country, but for exporting the technology for building coal-fired power plants in other countries. So these kind of problems our country is dealing with, we're still very much development-based, advancement-based, rather than being environmentally conscious. This new Green New Deal that the current government has really been propping up, actually, it's receiving a lot of bad feedback from international organizations. It's not very specific. It doesn't have the right spirit, if you may. So I think we have to have more than just words. We need to actually have actions that tell the world that we are serious about this climate change problem and all these impacts.
I understand this next question is going to be quite tough then. What should, in your opinion, Korea do then to better tackle that is the dual challenge of pollution and the pandemic?
Okay, did you say European countries? Or?
Korea.
Oh, Korea, yeah. Well,
I don't want the stigma of being an evil country. Neither do you. So.
That's true. Again, the government, I think, has to be more, have to have put more spirit into this. I think we just have not been very conscious of the environmental problem. The government itself, I think, needs to be more specific regarding the climate change issues. We always talk about in broad terms, but we don't have the specifics, and that's why we're being banged up by other countries. But also, since I talked about the government in the last question, the public also needs to be much more aware. I have this favorite quote that I always say is that, you know how Korean parents are very keen on educating their children. Well, if they could just think about where their children are going to live in, what kind of world their children are going to live in, a little while they're thinking about all these academic institutions and all the jobs and who they're going to marry and stuff. If they put just a little effort into thinking about the world that they're going to live in, I think we could have a much cleaner country. And so it's going to be a very comprehensive effort by the government, by the private sector, by the public sector. Right now it's very difficult because of the corona issues. But I think we have to prepare in advance before the corona issue gets settled of how we're going to tackle this problem from a government perspective and from like a public perspective.
I see. All right, Professor Sonu, thank you very much for your thoughts. And Mr. Royman, again, thank you for being with us today. Owing to the lack of time, we'll have to end it there. Right, well, that brings us to the end of today's edition of COVID-19. Tomorrow, we bring you details about COVID-19 and its impact on children and our furry friends. In the meantime, do take care and see you tomorrow.